Well, first of all, the role of the European Union is to support member state action in this area and to work with our stakeholders. One of the ways we do that is, of course, we have a lot of best practices across Europe which have been very often giving results in specific contexts. But one thing we need to do, I think, more systematically is to identify those best practices, including on issues such as pulmonary disease and airway disease, and then see how we can use the many instruments we have to facilitate their scaling up and their transfer to other settings. We also have a number of other tools we can use, powerful financial tools that can support this process. And also, if there are any gaps, for example, in knowledge, we have also research possibilities there. So it's a question of using the instruments we have to address these very important topics. Yes, well, first things first, I think we have a body of legislation that is directly relevant, addressing some of the most important risk factors. I would single out the Tobacco Products Directive, which is one of the most ambitious pieces of legislation globally in this matter. And I think it's very important that now this legislation is at an advanced stage of implementation. We work with the member states to support them and ensure that there is full implementation. We also, I think, need to pay a lot of attention to also the social inequalities issue. There is a strong link between airway disease and social inequalities, issues such as housing, environmental conditions, and so on. And even there, in some cases, like environmental policy, for example, we have also powerful tools like the air quality directives and other legislation. And of course, to work closely with the member states and our regions and local authorities on how we can support them, including through financial programs, in addressing some of these issues at their level. First of all, the voice of civil society is extremely important, particularly in the health area, where the expertise very often lies with the members of civil society, professional organizations, patients' organizations, various actors. So the first thing is, of course, I would very much encourage the participants to transmit that to the broader context. We are facilitating that through what we call the Health Policy Forum, where we bring together different actors. We encourage also organizations to work together, not just individually addressing the Commission, but also working together and having a dialogue across sectors. And then to formulate input into our policies, and we are trying to facilitate through creating the right platforms, etc., IT tools and so on. Also very important, we have instruments, what we call joint actions, where we bring together authorities from a number of member states, but they are also open to stakeholders. And indeed, I would very much encourage the participants in this event to actually participate in the stakeholder structures in that joint action, the CRODIS Plus, which will look at chronic disease in general, but of course respiratory disease is an important part of that. And I'm sure that would be a great help to what I was saying earlier, capture the many good practices and best practices that are happening all over Europe, and see how we can then translate that into action on the ground in other settings as well. I'm quite impressed by the progress, for example, and also the issue of patient empowerment, the way in which technological tools that we have available today, like e-health solutions, mobile health applications, are being increasingly used to improve the communication between patient and health provider, and have a dialogue between the two, because patients, and this is I think a key issue, patients should be partners in their own care, because they also have a lot of knowledge about their own condition, and that should be shared and utilized by the health professional. And I think the technology today makes that easier, provided we have, of course, the structures in place and we enable that change to happen. And that's something that the Commission is also looking at in the context of our wider action on the digital market, single market.